Good morning, Tim. Somebody confirm you can hear me, Moses?
Franklin Songoka, I confirm that you're loud and clear.
Thank you. All right. So I know we still have some colleagues who are struggling to to join. So let's just give ourselves a few minutes, maybe three to 4 minutes, and then we can start. Let's propose to start at 11:10. Otherwise, let me take this opportunity to welcome all of us into our virtual training or our release webinar, so to say. So my name is Franklin Songoka. I work at NASCOP SI. You're most welcome. Okay, I guess we can begin. Yeah, I guess we can begin. Unfortunately, I think that some colleagues from NASCOP were still struggling to join, but we can begin. Then we'll try to make sure that they join the call. Apologies. So good morning once more. Let me take this opportunity to welcome all of us into our release webinar. I think our main focus this morning is to take you through the updates on the TaifaCare KenyaEMR, which the version that we've currently introduced. So we'll be able to guide you on the upgrades. We'll also be able to talk about the new features and some of the fixes that we've been able to enhance, working closely with the Palladium team. And we'll also be able to just talk about data accuracy and the workflow efficiency that this new upgrade attempts to address. So, Moses, I would request that you can scroll your agenda up so that I can quickly go through it. Sorry, I need to share the agenda if you can, or I can share from my end. Kindly share the agenda for the meeting, please.
Sure, I'm putting it up.
All right. Yes, so this is the agenda for our meeting today. We should take about 2 hours or less if possible. So I think I'd already mentioned the goal of our meeting. Sorry, don't scroll up. Sorry, slowly. Yeah. So I think I'd already mentioned the goal of our meeting today. Basically, it's just to take you through the updates on KenyaEMR TaifaCare with the new upgrades. Talk about the new features. I think I talked about the bug fixes, and also we'll be able to just talk about how this will address the data accuracy in terms of the data transmission from the facility to the national data warehouse, and also it should be able to it should also be able to address the workflow efficiency. So objectives are, one, to identify stop scrolling, just stop there, to equip the system or users with sensitization to new features and workflows with TaifaCare 19.4.0. And this should then be able to identify key new features and enhancements during our demo today. Should be able to navigate change system workflows, should be able to correctly complete updated forms, should be able to generate and interpret new and improved reports, and understand resolved system bugs, and of course, technical support. So we should be able to guide you on the various links and of course the toll-free lines. Whenever you have any challenges, you can always be able to reach out to the team. So I think the first part we've already almost done with the first part. So after this, we'll go to we'll request a John to take us through key high-level highlights of the features. And then Eric Mudomi will take us through the demo on the workflow changes, and then Ogutu will come in to just talk about the system prerequisites, the pre-requirements overview and transmission updates. And then finally, we'll open it up for Q&A, which I will be able to take it up. So at this point, I want to maybe just request a few of our colleagues to just make very quick remarks, and then we begin. I don't know whether we have anyone from USG in the call. I'm not able to scroll through all the attendees, but in case there's anyone from USG, maybe kindly you can make a few remarks on behalf of the USG team. All right. Seems like they've not been able to join. Right. So I don't know whether we have any Casco in the call. Sorry, I'm not able to go through the whole list. So kindly, if you're a Casco in the call, you can just say what, make a few remarks on behalf of the Cascos, kindly.
Maybe Songoku, you may request if anyone wants to make a comment, they just raise their hand so that they can get the mic.
Oh, okay. Because all the other participants are muted. Okay, fine. All right. Okay. I don't know that Dr. Lily was able to join. I know she had challenges with Dr. Lily. In the call, kindly you can raise your hand. Yeah, I can see George has raised his hand, so maybe you can allow George to speak. I guess that's George Odingo, so you can give him the mic to just make some few remarks on behalf of the USG family. George, you can go ahead and mute. Otieno, have you enabled George to speak?
Yes, he just has up to unmute.
George, you can unmute. All right. Okay. All right. So meanwhile, maybe you can also give the mic to Faith, because Lily hasn't joined. Faith Ngari is in the call. You can also just give her the mic so that she can speak. But before I call in Faith, I think I'd seen Dr. Jacob in the call. Dr. Jacob, maybe on behalf of the team, you can just make some quick remarks before we begin, kindly. Dr. Jacob.
Okay. Can you hear me now?
Yes, Doc. I was worried. Yeah, I can hear you. Go
Yeah,
ahead.
so sorry, my microphone took a bit of time to be enabled. I think mine is to just welcome everyone to the meeting and state that I think we are continuously evolving the platform to meet the needs of the users and the stakeholders who rely on KenyaEMR for data as well as work automation. I think with this release, we think we have addressed quite a number of issues and enhancements and fixes that the team has been looking for. And we look forward to sharing this with you, but also for you taking up this for upgrading the facilities as needed. We look forward to any feedback from you as we do these releases and definitely collaborate with you to get the next cycle of issues. Thank you, and I'll give it back to you, Sangok.
Thank you. Thank you very much, Dr. Jacob, for your kind words. Yeah, I wanted to break protocol a bit. George, are you able to speak now? Before I welcome Faith on behalf of the NASCOP team. Okay. Maybe Faith, because of time, because I can see we're already 20 minutes into our time. Maybe Faith, maybe quick remarks before we hand over to Ajong. Faith, kindly.
Yeah, good morning. Confirm you can hear me.
Loud and clear, Faith. Proceed.
Yeah, thank you very much. I just don't want to say much. I just want to echo the words of Dr. Jacob. We are here to release what has been enhanced from your feedback, and we really appreciate your feedback. And so keep it coming so that we can be able to make the system more friendlier for use. And we appreciate your feedback all the time. So I just want to appreciate you for setting time aside to participate in this. And once the release is out, if there are any challenges, just like Dr. Jacob has said, do not hesitate to share back with the team so that we can make your work easier as you give service to our clients. Otherwise, thank you very much, and I hand it back to Songok.
Thank you. Thank you very much, Faith, for your remarks too. And because of time, I want to welcome Ajong, who will be able to take us through the first part of the presentation, just talking about the key highlights of the high-level highlights of the key features that we've been able to enhance. Then Ajong, after that, you can hand it over to Eric. Eric should then be able to take us through the demo. Then after that, Eric, you can hand it over to Ogutu because of time. Then after that, I'll take it up for Q&A. So Bernard, kindly over to you.
Okay, thanks Franklin for that. Good morning to everyone. I will take you through some of the highlights of the enhancements and bug fixes that are coming with this major release 19.40. So Moses, if you would just go to the next. Okay. Yeah, right. So last month we had the release for 19.33 that introduced for us one of the major security upgrades on the OpenMRS platform. That was version 2.6.16. This version is coming with even a higher platform upgrade, which means you are going to benefit from improved performance and stability of the OpenMRS platform. As well, this particular build is coming with a specific model that we've added an ML model that will be used to track the likelihood of patients who have missed appointments, whether they will be able to return to care or not. So this is specifically aimed at the care and treatment teams. And in particular, we will be availing those particular scores in the active on ART line list. It will also be available on the appointment line list and also on the attrition report. So this will actually enable the providers to actually see the likelihood of someone who's missed appointment, again, failing eventually to turn up or not, and thereby make corrective actions. As well, there's been some enhancement to the old ML model that is used to track interruption on treatment. So now you'll be able to find an alert on the patient homepage that would be able to give you a clear picture of the position of these clients without you going into, under the other specific sub-menus. As well, this particular build is coming to introduce an alert for pre-art viral load so that we are able to proactively monitor the position and status of our clients. Moses? All right. And then one of the key things that previously had been requested by the clients, by our users, has been the need to review the clinical encounter forms. And specifically, you will be seeing through our demo the reviewed shortened special clinics forms that will be applicable to several of the special clinics that are currently supported under TaifaCare. As well, there are additions of pre-anesthesia checklist, post-operation form, and also the CWC follow-up forms. Those have been introduced in this particular version. We are looking forward to also enhancements and fixes to cumulative fixes to the case surveillance module, and also fixes on some of the broken pipelines on viral load data sets, and also some of the HIV reporting issues that have been generally reported by the clients. With regard to malaria, we can confirm that there's been a number of improvements on how we'll be handling identification, testing, and reporting of malaria cases. This will be clearly demonstrated by Eric when he comes on board. Moses? Okay, so some of the new features, because Eric will not be in a position to demonstrate everything, so some of the simpler but bigger features that have been enhanced and included here are now highlighted in the following screenshots. So before you is the one on returning to care ML model. And as you can see, on the active line list of patients, you'll now be able to tell what is the score, what is the category, and the date on which this particular score was run. So as I explained before, it's going to help us proactively monitor people who have missed their appointments, the likelihood of them returning to care or not. The next item that has been enhanced again is to support this again is a missed appointment line list. As you can see again, that line list is coming with added columns on the same score, category, and evaluation. So once you run this list, you'll be able to tell the position or the likelihood of the clients failing to return to care, as said earlier. Next. Okay, so this is our old model on IIT prediction. The major change here is that this alert has been promoted to the patient homepage, and now you would be able to tell the category whether someone is low, medium, or high risk. And in turn, if you delve under the care panel on machine learning tab, you'll be able to tell the specific details. But the key thing is that right from the homepage, you should be able to tell whether someone is at risk or not of interrupting their treatment. Next. Okay, so next here is we take a look at the pre-art VL alert. Again, this is a new introduction to help with monitoring of viral load uptake before people begin treatment. And again, this will be available straight from the care panel on the program. Once someone is enrolled into HIV, you'll be prompted to go and record their VL if they fall into those particular categories that are highlighted for the PMTCT group, and also for people who are taking the first VL before they engage in treatment. So those are at a high level some of the screenshots of the major features that we will not be demonstrating today, but that are pretty self-explanatory for you from the system and from the reports that you'll be seeing. So I'll turn next to some of the bug fixes. Okay, so by no means is this list complete. There is a longer list of bug fixes that have been done cumulatively from 19.3.4 coming to 19.4.0. And you'll be able to find all of these in the release notes that will be coming out with this particular package. But allow me to just highlight some of them. So previously there was a problem with the last VL result date that it wasn't updating correctly. So this has been fixed. The VL justification column previously was pulling blank. So now this is being validly classified. Appointment calendar was redirecting to the homepage. Now it will actually take you to the correct list of people who are coming for appointment on the selected date. And then the MOH 705A and B outpatient summary. Previously, there was a misunderstanding of not discriminating revisits from the new visits, and therefore it was not correctly counting everyone who was presenting for outpatient services. So this has been fixed as well. Moses, is there anything else? Yeah, so like I mentioned, as I turn it over to Eric, this and many other fixes you'll see in the release notes that will be coming through with this particular package. Over to Eric.
Thank you, John, for that walkthrough, letting us know what we expect within the next release that will be coming to our facilities. I'll be doing a demo, but before we drop this particular slide, just allow me to highlight what we are going to see for the demo that I'm going to carry out. I'll be taking a use case of a patient within a facility while demonstrating what has changed within the system. And to start with, I'll be able to show some of the bugs that has been fixed within the triage, whereby one can now be able to save the triage form, having included even the decimal points. Then number two, within the same, we've introduced inform alerts that I'll be able to show that. Then from that, I'll come into the enhancement to the malaria clinical workflow. This is something that we've embedded together with the malaria program team. So I'll be able to show you what has changed within the system that will be catering the malaria clinical workflow. Then the other thing is our enhancement on the stock management module. And this is to now take care of the lab and other commodities. Again, I'll be able to demo that. The other part is on the special clinics. We know we've received feedback that we need to work or to lighten our special clinic forms. So I'll be able to showcase what we've done to these particular forms. And again, what Ajong has talked about on the appointment calendar, I'll be able to show that bug that which has been fixed. So allow me, Moses, to share my screen. Ajong, confirm that you can be able to see my screen.
Yeah, your screen is visible.
Yeah, so to start with, I'll go straight to the triage. And for this, allow me to do onboard a patient or register a patient so that I can be able to demonstrate and what the changes that we have within this particular instance. So for those who may not be familiar with this, I want to verify this particular patient. I'm using my own ID number to do the same to verify so that I can be able to consume my details from the client registry. Then I'll need to check in, which is starting in a visit. And at this particular point, I can be able to see for the share what the system is pulling from the client registry. Just a minute, already starting that. So I'll queue this particular patient to triage room number 1, and allow me to use mobile money for payments so that I can be able to demonstrate the changes that I've taken to that. So once I start the visit and queuing this particular patient to the triage, then I can walk to the triage. And at the triage room 1, we'll be able to see our patient whom we've queued. Then I can be able to call and serve this particular patient. So when I serve, the system takes me back to this particular page whereby now I can be able to record vitals. And this is one of the changes whereby we'll be able to see the things that we've changed. So allow me to even fill these. Let's say a patient who is coming with fever for 3 days, being sudden. You can add another one, presenting complaint. We want to take a use case of malaria. So, and again, we can have headache. So on the patient, the physical assessment, the patient came in walking, no any injury, and the patient was alert. So when you look at the vitals, let's say, for example, if we key in this particular value, so the system has now been enhanced to have the inform alerts that can be able to help the clinical team to be able to make clinical decisions and be able to queue even or triage this particular patient accordingly. So this has been done to all these areas. When you key in, let's say, a figure which is abnormal, the system will tell you whether is it high or is it even low, and with different color codes. So this is happening to all of these. So you can be able to see this is high depending with what you key in on that. So this is something that in the facilities now coming in with this particular version that will be released. So let me save this. So after we do the triage, I know we have the twos and the system will be able to give us the twos. I can be able to save this particular patient. That's all for the triage. So allow me to move this particular patient to the clinical room so that you can be able to see again the next part on the malaria workflow. So again, what happens at the facilities when I queue this particular person or patient? When you move to the consultation, you'll be able to see the consultation rooms, and we've queued our patient under the consultation room number 1. You can be able to see due to whatever you saw, the fever and that, you can be able to see the priority. Then we can be able to call this particular patient. Now, this is in the clinical room whereby I'll be showcasing some of the changes that we've done. So automatically when you come in, you'll be able to see the patient chart start with the patient visit summary. This is something that we've enhanced with this version, and it will be building up as we offer services. So for example, a clinician can be able to get the summary for this particular visit, and this is for this particular patient, some of the details for the patient. This is the latest vitals that have been taken, and if there is any history that has been recorded at the starting point. So we'll be able, as I proceed, that's the reason as to why I'm filling some of these, offering these services so that you can be able to see the new enhancement of the patient visit summary, how it is building up as we proceed. So at the clinical room, we'll navigate to the clinical encounter. Then we click on add. And again, at this particular point, due to what we saved, you can be able to see the alerts that are appearing. For example, suspected acute febrile illness. Then I can be able to offer these services. I can, again, retake these vitals, not vitals, but the complaints, depending with what maybe we may be getting another thing that this particular patient is presenting with other than what was taken. And again, here, I know most of the clinicians responded that we need to have these again taken by the clinicians, even if it was done at the triage. So again, you can be able to record. Because of time, you can just allow me to do this. Then here you can be able to add in a history of presenting complaints. Maybe you want to add more, maybe vomiting associated with so you can be able to give a history of presenting complaints. Then you can move to the past medical and surgical. If there is any, you can be able to record. And if there is any adverse drug reaction, again, you can be able to record. Nothing has changed under that particular section. Then you can say for the medication, yes, let's say this particular patient said that before this particular visit and taken paracetamol, then we move to the general examination. You can be able to give an examination findings. Nothing much has changed under this particular section. Then you go to the systemic finding. Again, that's just the same way we do it. If it's abnormal, you can be able to record, but if all the systems are normal, you can now be able to give impression. So I want to showcase the malaria, so allow me to pick malaria, and then you can be able to do investigation. So at this particular point, let us order for a malaria test. So when you come to the adding the malaria test, you'll be able to see this has been added to have even the malaria smear for malaria parasite. We will now be having malaria PCR test and the malaria rapid test. So these will be in the facilities when you upgrade to this particular version. So allow me to order this malaria rapid test. Then I save. Sign and close. Then at this particular point, I'll save my encounter. Then I'll move this particular patient to lab. Then I'll navigate back home. So when I get to the laboratory here, you'll be able to see the patient. I'll be required to bill. Allow me to use cash so that I can be able to showcase one of the changes that has been done under the accounting. So when you look at here, I cannot be able to proceed until I navigate to the accounting. So maybe a disclaimer, the user that I'm using has the privileges to be able to access all these particular modules and be able to transact. And that was done purposely for this particular demo. So when you get to the accounting then for the bills today, you'll be able to see this particular patient. And what has changed here is, there before we used to have a section here where my cursor is, where you could be able to carry out the transaction or be able to process this particular claim, so, or this particular bill. So what you need to do under the bill items, you need to click what this particular patient is coming to pay for. For those who are using M-Pesa, the SDK push, continue using that. But if maybe you want to process this particular payment, now you can be able to see where this has been moved on the right-hand side where my cursor is. It's where by now you can be able to process this particular bill. And when I click on payment, I need to pick the mode of payment. Is it cash? If it's cash, then the amount. If it's insurance, this is another walkthrough that will walk you to showcase starting from when you are checking in this particular patient, how we can be able to offer PHC services and even the shift services and how the system has been integrated with the other systems. Then for the mobile money, we'll need to get key in the amount and even the reference code, that is the M-Pesa reference code. So let me use this. So yeah, you'll need, for this to activate save and close, I'll need to have that code with me. So without this code, you'll not be able to process that particular. Then another thing is that the moment you click on payment, the system will bring now the pop-up. This is another enhancement that has been done within the system, unlike how we are used to do it within the facility. So the preview, the print preview automatically will pop up the moment you click the payment. And the end goal is the moment you click on the payment, even when this particular system is connected to a printer, then can be able to print this particular receipt for you. Then once we do that, those are the changes. Allow me to go back now to the laboratory bit. And when I expand this particular patient, you'll be able to see the system activates pick lab request. And I can now be able to pick and process this. When I pick it, it moves to the in progress. Here I can be able to expand my patient and be able to see this is the agency, the test that I'm supposed to undertake, that is the malaria rapid test, and which is in progress. The order number, the order date ordered by, and then if there is any instruction. So where the changes have happened, it's when you click on add results, now you'll be able to see this column on MRT stock item. What has been enhanced within the system is now we can be able to utilize the stocks within the stock management module, meaning that if I have tested and let's say the results were positive, I can be able to relate these, the test kit that I've used, I can be able to take its batch from the store. So you can be able to see within the lab store, we have this number of the malaria rapid test kits, 1478 remaining. So I may decide on which batch to use. If this is what I used, then I can be able to pick on that so that the system can be able to deduct and take care of your lab commodities. This is just like the way we do it within the drugs. Then another thing that has been enhanced here is if let's say the results are positive, we need to get the malaria species. And the option that was guided by the malaria program is to have the Plasmodium falciparum, that is for this particular test if it's positive. So when I save this, the 1478 will be deducted with the kit that I used, that one kit that I have used for this particular test. So that is, and then you can be able to see the system has saved. And upon refreshing, then you'll be able to see my patient is no longer in the progress, but completed. Now, meaning that I can even be able to see the results are completed, and I can be able to see my results here, the species and the malaria rapid test result, which is positive. So that is one of the enhancements. Allow me to use a separate patient here to demonstrate, because I could not be able to order only blood smear together with the other blood test for malaria. Now, under the blood smear, this is an order that I done earlier for a different patient. So when you get to the in progress and you want to add lab result for blood smear for malaria parasites, when you click on add, here you'll be able to see, let's say you've seen MPS scene, then you need to again to specify the malaria species that you've seen. So changes here, this is one of the change. We'll need now to specify if it's Plasmodium falciparum, then we'll need to give the malaria staging. We have the 3 options. And once you do the malaria staging, then you need to give the quantification. And let's say, for example, this is 20. Then you need to specify the type of smear. Is it thin smear or thick smear? So what happens when you say it's thin smear? The system will calculate the parasite count. And if it's thick smear, the system will do the same. So you can be able to see the count being given by the system. So there's another section under the Plasmodium falciparum that has been enhanced with consultation with the malaria programming team. So when you pick the rest, you'll be able to see nothing. You'll be able to see. But specifically for this part, that is what you'll be able to see as some of the changes. Getting back to my patient here, I need to requeue back, because now we have the results. Currently, we can be able to see under lab. Need to take back to outpatient. It was room number 1. Then I'll move again to consultation. So you'll be able to see my patient here coming from lab service. Then I can proceed. Then serve. So again, when you look at the patient visit summary, we can be able to see clinical notes. It's building up. We have now the lab results. It's again building up. So I'll navigate now to the clinical encounter for me to do the management. And here I'll not be required now to click hard, because this is the patient who is coming back from lab, but to continue with care. And when I click continue with care, here the system will be able to open up whatever in field. So I go direct to patient management. So here there is another enhancement that has been done, whereby if I pick any diagnosis which is related to malaria, more variables related to travel history will be availed. And again, the categorization of this particular diagnosis for malaria will be done automatically by the system. So let's say, for example, we take malaria due to Plasmodium falciparum. We'll be able to see diagnosis categorization. As long as this particular diagnosis is malaria, the system will categorize that as a new diagnosis. Then it will avail travel history variables, whereby when I click on add travel history, the system will open up. Sorry for that, should open up for me the variables that are related to the travel history. So that this has been validated only for number 1, for only diagnoses that are reportable for malaria. Then number 2, it will be again activated depending with the selected counties that will be guided by the malaria programming. So then after that, and we'll be able to notice that if you enter any other diagnosis which is not malaria, for example, like a pneumonia, you will not be able to see that. I can be able to demonstrate that. let's say, for example, you pick bacterial pneumonia, you'll only be able to see diagnosis categorization, and it's upon the clinician to say whether is it new or pre-existing diagnosis. And you'll not be able to see travel history. But if you pick the one that we picked, then you'll be able to see the system again doing the categorization and giving you the travel history. Then you can be able to do the drug prescription. And I'm doing this so that you can be able to see how the patient visit summary is building up. So allow me to raise this prescription very fast. It should be 24 tablets. And again, the system will be, as you're doing the prescription, will warn you because we've not yet saved our main diagnosis, so that as a clinician, you can be, you can remember to add that main diagnosis. So I just want to add 2. So yeah, can be able to give 18 tablets because it's for 3 days, no any refill. And this could be indication fever. Then after that, can sign and close. The system will get back to this particular section. Then we can be able to finalize this particular form, save and close. So when you get back again to the patient summary, after doing that, you'll be able to see the patient details, what you started with at the triage, with vitals, the history and examination, having the chief complaints, the history of presenting illness, and the medication taken before this visit. If there was any lab results, you'll be able to see it there. The diagnosis there at the top, starting with the main diagnosis, the other one is the impression, and then the pharmacy orders. If you could have given an appointment, it will be able to build up. So there is another enhancement whereby this particular patient visit summary will be building up depending with the services that this particular patient has received within that particular day. Another thing is that it's something which is you can be able to filter. When you click on this particular drop down here, you'll be able to see all other possible visits this particular patient has ever had within this particular facility, and you can be able to filter depending with the visit date. So let's say, for example, if there was one for yesterday, you could be able to see that date. When you click, the system will be able to filter that information depending with the date that you specified. Another thing, it's something which is printable. When you click on the print, there's the print view, and there's how it will be. You'll be able to see the patient particulars, the diagnosis, the chief complaints, all that will be having the clinical notes and the plan. So you'll be able to see this particular printout that you can be able to use or even give that particular patient. Then the other section that I need to talk about, it's under the clinical encounter, what we've done to lighten up the special clinics. So when you get to the special clinics, and I'll start with I'll demo 2, I'll start with audiology. So when you click on the record audiology, there before we used to have these forms with various pages in them. So where my cursor is, you can only be able to see it's only one page. And here you'll be only required to fill the visit type, the reason for visit, under the clinical assessment, it's for the clinicians or the specialists to type. Some of these forms, there are areas that are reportable, and those are the only sections that are very well structured in a way that maybe you have a select or even a drop down or even a date. So for example, for this particular audiology, this section was left because it is something which is reportable. And then you can be able to give your impression. If there is any investigation, you can order. After the patient comes back, you can be able to do the main diagnosis, then you prescribe and give a visit outcome. So that is how it has been done. Let me go to MOPC. I know it is one of most of the facilities are within the hospitals. So when you click on record, this form has been shortened. So you can be able to see again, visit type, the reason for visit, clinical assessment, you just only type, you give your impression. If need be, you can be able to do an investigation, give your main diagnosis, then you prescribe, and that's all. And like how it was there before with so many pages. This is happening to most of our special clinics. Will be having the same format as you've seen MOPC having that. The other thing is that there was an issue with our appointment. So when you get to the appointments here, when you click on this particular appointment calendar, it was taking you to home page. But right now, when you click on appointment calendar, it will take you to this calendar, not unlike there before. So it will be able to show you for a specific period, the clinics that have patients who have been booked, and you can be able now to drill down to that particular clinic. So this has been fixed and now working accordingly. The last thing that I need to showcase is on the stock management module. So under the stock management module, when you get to the items, and this is where we can be able to see the catalog of all the items that we have within the system, meaning that we can be able to carry out any transaction of these particular items. We only had all as the filter, pharmaceuticals, non-pharmaceuticals. So we've extended this to have lab commodities. And when you click on it, you'll be able to see anything related to lab. Then we've even included other, and this is other things, for example, tissue papers, bar soaps, Dettol, all those kitchen serviettes, all those things that we can be able to receive within the facility. So this has been extended, meaning that even under the operations here, when you can be able to carry out any transaction for those particular items. So one thing that I need to finalize with under the operations, it's on the positive adjustment. We know positive adjustment, this particular transaction is when maybe we've borrowed a certain commodity from another facility. Let's say, for example, it was a drug that we've borrowed. There before, the system was forcing us to pick an existing batch number. But remember, we may borrow a commodity which we do not have that batch number within the system. So how have we sorted this? When you're doing positive adjustment for something of the sort, so you need to select the location where we are doing the positive adjustment. Let's say it's main pharmacy. So here the system will give you the responsible person. So there is this particular section that we've added, batch adjustment type. It has two options, adjust existing batch. This means that the system will show you any other batch which may be exactly or any batch existing within the system. Then you'll be able to look at what you're adding, whether it is the same as that. But let's say, for example, we have a totally different batch that has never got into this particular system. That's when we'll click on add new stock. That is for the new batch. How will this work? Let me start with the existing one. When you click on add existing batch, I'll need to select the reason received from other facilities. I'll use paracetamol. So when you select this particular item, you'll be able, or drug or any commodity, the first thing you'll be able to see it's the batch number. So when you click on this, the system will be able to show you all these particular batches related to this particular item. Then if whatever you borrowed from another facility bears the same batch number, then you can be able to reuse. This is just to only help the users not to, again, be typing this the same batch number if it exists within that particular system. Then for adding a new, when you click add new stock, then you move to the next section here with the same drug. So the system will now allow you to type. Here you can be able to type now your new batch number and proceed with your transaction. That's all from my end. Allow me to usher in my colleague Ogutu to proceed. Ogutu.
Thank you so much for the highlights. I think we are getting feedback from the team using the emojis, meaning that all is good. So Moses, can we have the presentation on the slide? We'll be looking at some of the configurations changes due to the additional enhancements that have been done into the system. And the notable one is the artist model, which has been Dockerized currently. And after doing the configuration, the SOP to do this and the resources are available, and you can always access them via that particular SOP. We have links to the downloads and on how to do the configuration. So we have a number of global properties that you'll be able to update and just confirm that they are correctly configured for the RCT model to work. We have an additional scheduler, the generate RTC ML prediction scheduler that can be configured to run at specific intervals depending on the facility or server, server resources. So it's configurable, and it's not like a static or standard for any facility, but we always advise that resource intensive schedulers can be scheduled to run late in the evening or at night to generate the scores so that the same is updated. Other than the schedulers, we have the global properties, the machine learning API and API URL. We also have the KenyaEMR machine learning. Okay, on the right, we have the link to the Dockerized IIT model SOP, whereby if you click on that link, you'll be able to access the SOP that includes the resources to be used on the SOMs. So these are some of the global properties that we'll be updating next. On the case surveillance, this is another enhancement that had been done to the system, the case surveillance and the key data transmission settings that are supposed to be done after system upgrades. We have the facility code. Ensure the correct facility code is what has been updated on the global property value for facility.mfl code feature. Kindly confirm. We also noted during our routine support that some facility are missing this particular global property, and if in case you're one of those facilities, you can always reach out through our contacts that will be displayed here so that we can support on the same. Ensure the correct facility MFL code is updated on this particular global property. If not, the case surveillance data will not be transmitted for your server. And also on the fetch date, I'll also be able to configure this so that it doesn't start from way back like in 2020 or 2010. That means that you'll be populating data from that period to date that will be taking much of the time, and most probably those will not be in use. So you'll always configure this to run from the recent date to ensure that the recent information is picked for the case surveillance. On the task scheduler, we have the program monitoring scheduler that can be is configured depending on the facility server resources because it's especially for the high volume sites. We'd advise that this is scheduled to run late in the evening or at night because it might interrupt normal service delivery, especially during morning hours and early afternoon. So we advise this to be configured depending on facility resources. So there are those that can run even during when service delivery is going on, and there are those that are when this schedule runs, when service delivery is ongoing, the system tends to be slow. So this one, if in case you experience the same, you can always monitor and advise. On DWAPI transmission, DWAPI has been updated to now transmit T-series scores and also general anxiety disorder information. So the new release will come with a new DWAPI version that will be able to transmit the same. On support resources, we have quite a number of resources that we've worked on. We have the SOPs and job aids on our website that you can always access via the link shared, and all our webinars are always, the recorded webinars are always updated in our YouTube channel that you can always access, including this one. You'll be able to get the same, and also other to do how to do stuff in the system are also recorded and also updated in our YouTube channel. So you can always access the same at your own free time, go through as we learn and utilize the various features we have in our system. We also have a community platform whereby we have the frequently asked questions and their answers. You can always contribute and also ask your questions, and the moment you ask any questions, the notifications are sent to various persons who will be able to help you and respond on the same. I think that is all for my end. So the task reminders, that one is program monitoring. We've already covered that. Rebuilding of search index after every upgrade is advisable so that users can always search for the patients easily. In any case you don't rebuild search index, when they search for patients to serve, they'll always not get them. So after every upgrade, always ensure that search index is rebuilt. For this one applies to both on-prem servers and cloud-based servers. So after every upgrade, when the instances are restarted, it's always advisable to rebuild search index for all the sites to ensure that a service delivery is not disrupted due to clients not being found when searched in the system. So the configuration of the Docker SML, we've already captured that, and you can always get more information from the SOP. Thank you. I would usher in Songok to continue the call to action.
Thank you. Thank you very much, Kennedy. Thanks, Leonard Juang and Eric Mudomi for the good work. I think Leonard, you're able to take us through very high-level highlights of what the kind of enhancements that have been done to the system to further improve and make it more user-friendly. Of importance is to ensure that the platform is upgraded, which would then improve the performance and, of course, the security baseline. I think one of the very, very important features, and this is what most of the users have been asking about, is the RTC risk score in the reports. So I know we've had a bit of challenges here, but I think the fixes or the enhancements will now be able to will go a long way in fixing that. And of course, the IITML alerts. More importantly, the VL the viral load alerts, and yeah, and looking at the clinical form enhancements for the special clinics, pre-anesthesia checklist, post-operation forms and child welfare clinic in MNCH. The other fix, again, is around case surveillance and viral load datasets. I know we've had lots of concerns regarding what is available on site and what is available above site. So we are hoping that once you upgrade, all those should be resolved, and once the transmission begins, whatever we have at the facility level should almost more like mirror, especially for case surveillance, which are real time, should mirror what is above site, and more importantly, the announcements that have been also extended to the malaria clinical module. And I think Eric came in to just emphasize on what Ajwang had covered in form of an highlight, just taking us through the demo. And lastly, Ogut was able to also just provide some bit of guidance on what exactly is expected of us in terms of ensuring that for us to be able to enjoy these features, we need to ensure that we upgrade our system, our platform generally, to be able to then enjoy the enhancements and utilize the enhancements that have been done to our platform. So at this point, before I go to the call to action, and I would request that probably Moses, you need to pull this down a bit so that we can transition to Q&A, and then we will be able to talk about the call to action, or we'll come back to call to action later once we are done with the Q&A. So I wanted to quickly just go through the chats, because I think I'd seen lots of questions that had been posted on the chat. I know I forgot to mention that we have colleagues on the call who should be able to address some of the concerns as we were going on with the presentation, but I'm happy that yes, the team is very much available and they've been able to address some of the questions. Apologies for our colleagues who struggled in terms of joining. I think we had sort of a limit with our link, but the beauty is that I think Otieno and team had already provided us with an alternative. That's the YouTube channel, and I'm glad that some of us were able to join using the YouTube channel. Yeah. So I'd seen some questions from Bernard. I think that had already been responded to by Marianne at some point. I'm just looking out for those that have not been responded to before we go to the Q&A. So there's a question from Victor Achando. There's been this problem of viral loads with already results pulled appearing as still in progress, thereby making the client to appear as having invalid viral load. When you try to update manually, then it generates an error and the result is not picked. So maybe Eric, you can prepare to respond to that. After the upgrade to version 19.3.3, despite documenting the date, patient was confirmed HIV positive. When you run a line list TX card, the field appears blank as it's been sorted. Probably you can also respond to that. I'm not sure whether it's been responded to, but if not, then you can also just respond to that. What about the CD4 qualitative results not reflecting in ART register, but only accepts quantitative results? Eric, I think you can also take that up. Some facilities use MRDTs when we have power loss. How will we specify the type of plasmodium? Eric, maybe you can add your voice to that. All right, apologies to Robert Kirui. I think you waited for long. I hope you're able to join finally. Okay, oh yeah, I think the question regarding MRDTs, okay, this is applicable only for blood smear tests based on what is ordered for the patient. So I hope that's sufficient to the colleague who had asked that. What about the enrollment of lost follow-up? The HIV initial forms does not appear in it appears for TIs. Okay, I guess you're asking about the HIV initial form in regards to you're asking about the lost follow-up. I don't quite clearly understand that question. Probably maybe Lynette, you can probably just clarify what exactly the concern is there. Kindly also demo for IDSR report and 705 reporting output for malaria. Maybe Eric, you can also just comment on that. Did you add learner capability in dispensing module? Yes, I can answer that. That was already added, and probably maybe you can just speak about that. Good work. Stock module, what would be the difference between the non-pharmaceuticals and lab commodities? Onyango George, on this version, are we able to do VL orders and results retrospectively? Yeah, I know this has been some concern. I don't know that has been resolved now. Then from Marianne Wang, I think you've responded to the CD4 question. Joseph Nyamai Wenzi, can you upgrade from 19.33 to this version directly, or there is an intermediary upgrade? In some facilities operated by Dreams, the system is logging out from 12 noon since the upgrade. What could be the challenge? Okay, that's a serious one. So we may need to address that. Maybe you need to reach out to service desk. I think Philemon has already suggested that down there, so that they can be able to access your remotely your database and all your system, so that they can be able to address. All right, so I know there's so many other questions here. I may not really be able to go through all of them, but I'll request the team to go through it and then respond to them on the wall. Kindly review the prep data sync between KenyaEMR and the data warehouse or CBS dashboard. We have been checking for missing or incomplete client information, but the register do not show notable gaps. Kindly help us understand where the disconnect could be. And I think Rael, this upgrade should be able to fix that. I think we've had some challenges for quite some time, but the team has been working around the clock to fix that, and that the upgrade should be able to fix it. Okay. Yeah, so I think yeah, most of the other questions have already been responded to. Thanks, Marianne, Mary Gikura, Otieno, Philemon, for being on standby to respond to some of those questions. So, maybe you can if you want to voice it, you can raise your hand so that we can give you the mic. Meanwhile, the team will be able to respond. The bit on the wall is that the team has taken care of that, so they should be able to address them, each of those concerns that you've posted on the wall. But in case there is any that you want to voice, I think this is an opportunity for us to also just take a few minutes to answer some of those questions. Any hand up? So you raise your hand so that we can give you the mic, because we opted to ensure that everyone is muted except the presenters, but we should be able to give you the mic to speak if there's a question or if there's a suggestion. It doesn't have to be a question. If there's a suggestion that you want to make, you can also congratulate the team for the good work that they've done. So we can start with Alice. Otieno, you can allow Alice, and then after Alice, Stephen Nyongesa. So Alice, you can go first. Check if you allow.
Thank you very much. I want to appreciate our team for SIAYA. They have been really helpful for us. So my first concern, in the maternity module, among the inpatient forms, we could not manage to get the labor care guide, also known as the pathograph. And again, for the initial diagnosis, when a mother comes into the labor, it's either it's active phase of labor or lower abdominal pain. So if we try to type the diagnosis, it's not bringing us. So we had to type spontaneous vertex delivery for us to continue. Another concern in our NCH, for when we were registering the children, the under 5 children in MOH 711, in the MOH 511, we could not populate the same back to the register, even after filling in the CWC form. When I'm running that report, I'm getting 00 from the register MOH 511. Another concern in MOH 47, that is for nutrition, it's populating so well, MOH 47A and B. But now when I want to run that report back in MOH 733B, that form is missing. Otherwise, thank you. Those are my concerns.
Thank you, Alice. Which facility is that kindly?
This is Usigu Sub-County Hospital.
Usigu. Okay, that's in CI, right?
Yeah, in CI.
Okay, thank you. Yeah, so we can take two more, and then Eric and Tim can respond. So Stephen Nyongesa and then Amos.
Yeah, thank you so much, Songok. And one is just to appreciate the Palladium team together with NASCOP on this particular sensitization. I think it's a better version, and I think we've seen the highlights here. One concern that I have, and more or less it's a suggestion as well, and this one is basically based on what we've seen in the most recent call to upgrade. I think what at partner level, especially maybe speaking on behalf of the partner that I work with, we really faced a difficult time, especially when the timelines, concerning the timelines around the upgrade process. I wanted just to verbalize what I've indicated in the chat, that I think we need to, and basically it goes back to the Palladium team and obviously with guidance from NASCOP, to offer some very realistic timelines when it comes to the upgrade process. We do understand that it needs to be done fast, but also different considerations need to be put in place. In as much as we do have some facilities on cloud, we also do have a number of facilities on premise, and such require human resources to be on the ground to effect those upgrades. So maybe just a request that we also issue out very realistic timelines, considering the different statuses at facility level, so that the upgrades can be done with efficiency and also allow the facilities to proceed with service provision in as much as the upgrades are being conducted. Otherwise, I appreciate your team and also this session. Thank you so much.
Right. Thank you, Steven. So we can take one from Amos, and then we'll allow the team to respond to, then we can take another round from Jared and the rest. So Amos.
Okay, good afternoon, team. Thank you for the wonderful presentation that you have taken us through. Yeah, so my question is on inpatient. So first, let me introduce myself. I'm Amos from Taita, that is Moi County Referral Hospital, HRIO. So as a facility, we are planning to use KenyaEMR as our main EMR system within our facility. Yeah? So the main issue that I'm having or concern is on inpatient coding. How does a system, how can that system allow us to do the inpatient coding? Then on also appointment, is it the doctor who is seeing the patient who is able to issue an appointment, or is the HRIO from that facility? Another concern is on how soon will that version be installed? How can it be installed within our facility so that we can, because we are planning for training as a facility. So how soon can it be done so that we don't also lie behind on implementation? Thank you.
Right, thanks. Thanks, Amos. I think we received that request from Moi County Referral Hospital in Taita. So yeah, and thanks for bringing your concerns up, so that as you plan to scale up the utilization of EMR as facility-wide, some of the questions or some of the concerns you have, we are able to, or the team is able to address them. And then I think your question is also just tied to what a question that was raised by Wycliffe also with the CHRIO in Vihiga regarding the utilization of ICD 11. So at this point, allow me to request the team to respond. Eric, I don't know whether you're able to take note of all the concerns, all the questions. We can take that, and then we can take some more. Eric, over to you.
Songok, thank you.
Kindly allowed also to ask this, please.
Sorry?
Amos, still Amos. Kindly allow
Okay.
me to ask the final one.
Okay.
Yeah, that is on the lab integration. Since as a facility, we also have the lab uses LIMS, they have their system. So how is it possible also to integrate the Kenya EMR with the lab system? Thank you.
Yeah, so maybe I can respond to that the last question you've asked regarding the lab integration. That's the Kenya EMR integration with LIMS. So that's an ongoing process. So we are working closely with the lab team to resolve some of the issues that were encountered earlier. So once that is sorted, which we hope it should be done within the next 1 week or so, then by the time probably you're beginning your deployment, we will have a fix. So NASCOP, the NHRL team, and the Palladium team are working closely to be able to resolve that and ensure that there is seamless integration between Kenya EMR and LIMS. So that is work in progress, and it's being worked on. Yes, so Eric.
Thank you, Songok. Let me respond to those questions before we take maybe another bunch of questions. To start with a question that was asked by Alice on the maternity module, that they could not be able to get a labor care guide. We are in the final stages of having the labor care guide within our release, but currently in the facilities, you can be able to access Patograph. For the CIR facilities, I know, and Otieno Bernard may confirm this, there is some of the configuration settings on the locations that are needed to be done so that we could be able to see Patograph appearing. Otieno will mention. So it's not an issue, it's not an issue that is with the system that needs to be enhanced. It's something to do with how the setup or the configuration, something that needs to be done within the facility. Then you talked about the initial labor. When a mother presents at the maternity, you are forced to type a different diagnosis. And I think, Alice, we will need to get more details from you, maybe later after this call, because most of the areas that we have diagnosis, the guidance was to use ICD-11. So we need to check what you're missing and what you want to type. Is it in the ICD-11? If it's not there, then we can be able to deliberate on how we are going to have something that is working for you within the facility. That goes on the system not generating 511. We'll need to look at that. So allow us, Alice, to check on that. The same with 733. Then, Stephen, that was a suggestion. And I know maybe Songok on the upgrading will mention that particular. It's a suggestion that was being given by Stephen on maybe the timelines. He said that previously they encountered some difficulties because of the tight deadline. But I know the tight deadline, it was because of the security part, and Ajuang talked about that. But I know Songok will talk about that. Amos, you asked about the inpatient, how can the system help in coding? So, and again, how we've designed the system is that where we need to have, for example, a diagnosis for the inpatient, we've aligned that as per ICD-11. I know manually how it used to work within the facilities. The HRLs could take a file, go through it, get the diagnosis, and then they are the ones maybe even could be able to do the diagnosis. But again, Amos, as you've requested for the system, we can work to improve where you think needs to be improved for the system to be able to help you in your day-to-day activities that you carry out. Then is it the clinician who is giving the appointment or it's the HRIO? So the system has been left not mandating the clinician to give, but even the HRIO can be given the privileges, can access the appointment module that I showcased when I clicked on the appointment, and I can be able to even give the appointment. So even HRIO can be able to give the appointment. But depending on how the setup of the facility is, so the system allows that. Then how soon can it be installed? I think that one Songkok mentioned, that is for Songkok to respond to together with the lab integration. That's all for the first batch. Songkok, over to you.
Thanks. Maybe this is to Amos from data. There's a clarification that Dr. Jacob is requesting for. Maybe I probably didn't also voice it. If you don't mind, you can probably just specify which LIMS system are you currently using for, and I think that would help for purposes of traction, because probably maybe the facilities that are currently being that are currently being supported are probably using a different LIMS system. So probably you may need to let us know which LIMS system you're using. So Amos, maybe just as 30 seconds, you can just tell us which LIMS system you're using. Okay, I can see his mic is disabled for now. Okay, fine. But you can post Amos. You can post on the chat. You can reply to Dr. Jacob. Right. So I think most of the questions that are on the wall have been responded to. So maybe we can take more. So I can see Jared's hand is up, and then Mwangi Mudomi. So Otieno, you can allow Jared to speak, and then next is Mwangi. So Jared, go ahead.
Thank you, team. That is Team Palladium and all the stakeholders who have organized these very important updates on TaifaCare. I'm Jared Omondi from Siaya, Ugenya Sub-County. I coordinate lab services. I want to thank the team so much for bringing on board the stock management for lab. My concern is that in the laboratory, we have reagents like GEMSA, which comes to our facility in terms of powder, and then GEMSA is reconstituted or prepared using other reagents like absolute methanol, glycerin, and even distilled water, so that the end use reagent is a multiple of other reagents. So is the current stock management module for lab is only at the level of the unprepared reagent, or can it even be used at the level of a test if we leave alone the rapids, which can easily be managed? That is my concern. And back to you.
Thanks, Jared. I think that's a valid concern. So we'll be able to respond on whether on whether the system can be able to take up the prepared reagents other than the conventional ones that we know are supplied here. So Amos, you want to respond to, I don't know whether you've been able to post it, but if you want to speak, it's okay. Maybe you can allow Amos to speak, to just tell us which system they're using. Yeah, Amos, just 1 minute or a second.
Yeah, sorry. The chat also has been disabled. So the system is Labware 8.
Labware 8.
Yes.
Okay, so I will follow that up. Thanks.
Okay.
All right, so maybe we can go to Mwangi and then Victor Uchando. Then Eric or the other the team members can respond. So Mwangi Mudoni. Mwangi, you have the mic, you can unmute, or if not, we can allow Victor. Victor, go ahead.
Good afternoon, everyone. My name is Victor Chando from Wire SDA Dispensary. There is a question I shared on the chat, but so far it has not been responded to, about the problem to do with viral loads. Then the second question was on the actually date that a client was confirmed HIV positive, which was not appearing in the TaifaCare line list. Then lastly, there has been this problem of when it comes to cervical cancer screening, there is the age bracket that is actually acceptable within the system. But sometimes when you run the line list of those clients who have actually been screened, have been done to cervical cancer screening, you realize that there are even children who are 9 years old. They are appearing in that list, while it doesn't actually allow for the option of doing cervical cancer screening to those who are not within the required bracket. So my question is, has this been actually solved? Or if it has not been solved, what actually prompts this to actually happen so that we can get rid of it?
Okay, thanks, Victor. So maybe Eric, you can respond one on the prepared reagents at the facility, and then the date confirmed HIV positive. Based on what Victor has said, it seems like that is missing, and then the cancer screening from the line list, it includes children below 9 years. So maybe you can quickly respond to that.
Thank you, Songok. Allow me to respond to Jared's question, and then maybe I can usher in one of our QA to respond to the issues to do with the viral loads, whether those bugs are still there. So, Jared, on the lab commodities to do with the stock management, it's when we've started working on that. So, what of the mod to start with malaria commodities? That is what we've started with. That is the first bit. We're still trying to figure out how we can be able to work out on these particular other commodities that you've talked about. It's something that we're discussing to see how this can be done. But to start with, we've started with only, for example, the malaria, the test kit, because you know that is a kit that is one-to-one that we can be able to associate with a patient where this particular kit was used. So for now, even for the package that will be going out, we'll only first support the malaria bit. But again, we still, that will not be the end. We'll be able to figure out how we can be able to record and even come up with the rest. And I know with your input, in future, we can be able to come up with a great lab stock management module. For Victor, the issue on the viral load, Songkok, I don't know whether there is any other person from my team, that is from Palladium, who would want to respond to that particular question on viral load. Because some of these questions Victor raised, there are some of the questions that need to be looked at the facility level, because I don't know whether it is happening to all the facilities or it's only to his facility, so that you can be able to drill down and be able to see why you've been starting on ART and that particular date is not appearing in a certain line list.
Oh, okay.
Then
I don't know.
For the cervical cancer,
just go ahead.
For the cervical cancer, again, from the last question on cervical cancer, that you're able to screen, the system is able to regulate in terms of the age, but when it comes to output, it has even children, whereas in the data collection, the system does not allow. So it's something that we need again to investigate, because our outputs are from what was recorded within the system. So we might need to investigate further and be able to know how comes we have children in the output, yet we are not able to do screening for them. Over to you, Songok.
Thank you, Eric, for your responses. Maybe Ogutu, I don't know whether you had any experiences regarding the issue around viral load, or probably I would request Victor to reach out to the service desk team. I know they had already posted their contacts so that they can be able to do some bit of investigation, and I think that would also be extended to cervical cancer screening, because that is an anomaly that needs to be fixed. So I would request that Victor, you can reach out to service desk team. Ogutu and team should be able to address that. Ogutu, do you have any comment on that really at this point?
I think through our contacts, you should be able to reach out so that you triage and check on the issue.
Okay. Yeah, Mwaki Mudoni, I don't know that you're able to speak now. You had the mic at some point, but you, Otieno, maybe you can allow.
Sorry.
Oh yeah, go ahead.
Okay. Afternoon, everyone. My name is Mwaki Mudoni from Taifa Sub-County Hospital. In regards to the nutrition department, we have a problem when it comes to the reporting tools. That is the MOH 734, 713, and 704. They were not available in the older version. So I was asking if they are available in this current version. Thank you.
All right, thanks. I think someone had already raised that at some point regarding nutrition tools and even the registers. So I think that will be followed up. The team has taken note of that. Thank you, Mwangi. All right, so I'm not seeing any other hand up. I'm hoping that the questions on the chat have been. I know the team has been available to just respond to all your questions, so to say. And that doesn't really stop you from reaching out at any one given time. If you encounter any challenges, Ogutu has already posted, Philemon has already reposted again and again, the toll-free line, where you can always reach out. And of course, most of us do have direct links with the HIS focal persons from Palladium, so you can always reach out to them. They'll be able to support you remotely. So at this point, I want to say thank you very much, team, for finding time to be with us today. So I think we are coming towards the end of our meeting, but before we do that, I want to quickly take you through the call to action, then we close. So Moses, you can bring back the slide and go straight to the call to action. Then I'll make one announcement. Then we should be able to then close. We will allow a few speakers to make their final remarks. And then we close. So this is our request to all of us as our stakeholders. One is we are requesting that you upgrade to TaifaCare 19.4.0 with the platform upgrade to OpenMRS 2.8.6. And I think I'd already emphasized on this. If you don't know that, then you'll not be able to have visibility of the improved performance and of course the security features and all the enhancements that we've talked about. We also expect that all facilities should be able to take up the new Dockerized ML, that is a machine learning IT module, and this will ensure that all the correct alerts of all the clients we have visibility of all the alerts within the facility, and I think at the end of the day, whenever we have these alerts, it has a meaning. It's not just a flag, but it has a meaning. It then requires us to ensure that we act accordingly based on what the alert really is meant to communicate to us. So I think of importance for us is to ensure that we work closely with all the stakeholders to be able to upgrade. We are hoping that this release we should be able to share with you within probably maybe on Monday. The QA team will guide us on that, and Rain and team should be able to guide us on when they should be ready. Once it is ready, we should communicate. We should share with you, of course, with clear instructions on how to conduct the upgrade and of course also the timelines. But in case you run into any challenges, please do not hesitate to to reach out to the team. So having said that, then allow me to request maybe one or two of our colleagues to quickly make some remarks, and then we should be able to close. So I think I'd seen one CHRIO in the call. There were a few who were in, but I'd seen Wycliffe. I don't know, Wycliffe, are you able to maybe just make some remarks on behalf of the CHRIOs and HRIOs in the call, or any other HRIO in the call? Maybe you can raise your hand so that we can give you the mic. Because I think I'd seen quite a number of CHRIOs and HRIOs in the call. Okay, I guess probably maybe Wycliffe's dropped. Any Casco in the call, you can raise your hand, please. Right. I'm not seeing anyone. All right, sawa, it's okay. So I think probably I want to then request maybe Dr. Jacob to make some closing remarks, and then request Faith Ngare from NASCOP, my colleague at NASCOP, to also just make some closing remarks and close the meeting for us. So maybe Dr. Jacob, any parting shots as we close the meeting, kindly?
Songok, maybe I'll ask Diana to first say something, then I can make my comment. Diana.
That's fine. That's fine. Diana.
Thanks, Dr. Jacob and Songok, and good afternoon, everyone. This is so exciting when we have such sessions, as we get not only provide information, but get very valuable feedback from the teams that are using the system. We have taken note of all the issues that have been raised. If you feel like you had a question that was not comprehensively answered, please feel free to reach out so that we can ensure that we understand fully the issues that you're experiencing, or feedback, so that we can comprehensively respond to you. So thanks everyone for your time to join this meeting, and also to support the end users, and also the end users who are on the call for being very responsive, and also just ensuring that you give feedback so that we can improve the user experience as you are interacting with your clients. We have the same goal, and as Palladium, we are so committed to ensuring that we are responsive to the user needs, and also ensuring that we have resources that will be able to support you to ensure that you can see your clients and give them good care. So we have resources. This is not just a complete, this is not a training, this is just a sensitization, just to highlight what is coming up. But we will plan sessions where we are targeted on specific areas. And then when we just tackle those areas comprehensively, taking time also to get feedback, and also to just take the team through it end to end. So this is not the end. We'll plan different sessions. Be on the lookout for that, so that you have the capacity to support the facilities, and also the facility staff. You have capacity to ensure that when you're using the system, it's seamless process, and you can see the clients promptly. So thanks again, and we look forward to continuous feedback, and we will catch up again in the next session. Back to you, Dr. Jacob.
Thanks, Diana, for that. For me, I want to just address three things. So the first one is that the e-claims feature, although we are packaging it with the relase, we will not activate it, because we are working with the Digital Health Agency to make sure that it is correctly piloted. So I think those who are responsible for implementing the system, please do not activate any e-claims. It may not even work until we are aligned with the DHA that the financial processes are clearly set and correctly configured for it to be rolled out. I think there are facilities we are working with to make sure that the pilot is successful, for PHC especially, and then shift will come at some point. Please be supportive, help us get the feedback we need to refine the feature. The second thing I would like to talk about is our release process. During the meeting, you may have noticed that we have enhancements and we have bug fixes. when it comes to fixes and bugs, these sometimes are very distressful to users because it really affects how you can deliver services. We are going to change how we do releases. The meeting we have had today is a major release. We are going to be giving hot fixes in between major releases, but only those who require those fixes should be obligated to take up. So those are essentially optional updates, releases that you will take only if you need the fix that's in the package. But then the major releases, it essentially means that all the implementation should ideally be on that release. My request, I think Marianne is on this call, and Andreen, let us organize a very targeted training of the implementers on our release process in the next 1 week so that they can be able to be aligned. The reason we do releases, and I think this is a very important learning, because we really held so much fixes until this release to the point where some of the users were really, really frustrated. So we would like to change a little bit of that so that their major releases can be done regularly, but then the minor releases and the hot fixes can be done even weekly, so that then those who need those fixes can be able to access them. And I know it's a very delicate balance between those who want the fixes and those who do not have resources to go to the sites every week. So that's very, very important that we do communicate. So Marianne and Andreen kindly organize for that so that we are able to move forward. My final comment is about the EMR. The EMR is now facility-wide. And sometimes the people who naturally come for these meetings are people who have used KenyaEMR for many years. Again, as we do the targeted trainings, I think we really need to focus on some of the non-HIV components, billing, where we have done quite a bit of improvement, and malaria. I know we have a team that's supporting the malaria programs, commodity management, so that we make sure that those users who normally use those systems are able to basically understand how to use the solutions correctly. Otherwise, I want to appreciate everyone for making it through to the end of the meeting. We are committed to try and address your issues as soon as they become available, and then also managing the release cycles so that then you do not take up these releases that you may not really need for your sites. I want to give it back to Songok for any additional comments before we close.
Thank you, Dr. Jacob, for the guidance. I think that's very, very critical, because one of the questions one of the participants had asked earlier is the integration with the SHA claims, and I think you've clarified that. Thanks. One more announcement before I request Faith Ngare to close the meeting for us is that we are planning to have another training, the training that is coming up on Tuesday at 2 p.m. and we are requesting that all of us also just find time to attend. Will be more specifically on LEN prep. So prep generally, but more focus will be on LEN prep because remember this is a new molecule that has been introduced, and the country is very keen on monitoring uptake. So we have planned a targeted training for LEN prep next week on Tuesday at 2. So I'll be sharing out the link, and I would urge all of us to kindly extend the invite to the facility teams, because we may not have contacts of all the facility teams, but we request you to help us on that front to extend the links to the facility teams, and please support them to attend that training, because remember, our main target at the facility, the end users at the facility level, because these are the people who are interacting with clients, these are the people who are interacting with the system, and these are the service providers who we expect to support us in ensuring that proper documentation is done as we provide the services. We really need to have visibility of what is happening at the facility level. So some of the issues that I think we experienced previously have already been addressed. So we are hoping that moving forward, we should be able to then have real-time data above site. So I'll be sending that communication immediately after this, and I would really request that we extend to our service providers and support them to join the training. Otherwise, from my end, I want to take this opportunity to more sincerely appreciate all of you for attending this training. These are very, very critical meetings for us, especially in building the capacity of all of us, including the service providers, in supporting and utilizing EMR. more specifically in this case, KenyaEMR in our facilities. So we really feel appreciated, and then we'll always be looking out for your support. So at this point, allow me to welcome Faith Ngare, who will make the final remarks. And Faith, I'll also request that you can pray for us as you close the meeting. From my end, thank you very much. Have a blessed weekend ahead. Asanteni.
Thank you, Songok. You can hear me, right?
Loud and clear. Go ahead, Faith.
Okay, so I think first is to appreciate all of you for taking time to participate in this. And as Faith, I think I'll first say I'm quite excited looking at where KenyaEMR has come from to where we are today. And because of your keenness on making sure that it gives you the right services to deliver what you should deliver to the patients, I think we have come a great milestone. We've covered a great milestone. So I really want to thank all of you. And as it has been said by the presenters and by the team at Palladium, kindly do not hesitate to share what you feel needs to be done to the system to enable you be able to deliver the services well. Otherwise, to the Palladium team, thank you for the efforts in making this happen. And I will also insist on part of what Dr. Jacob has said. I know we've grown with KenyaEMR as a HIV system, but now it's a facility-wide system. So as we embrace TaifaCare, let's also begin to look at other areas of management as we deliver our services to other specific conditions to make sure that it is able to respond to all our needs. I'm happy it's even able to do a bit of commodity management, and it's work in progress. And so we are hopeful that eventually it's really going to make it easy from service delivery when the patient is found, brought to the facility, the commodities that are utilized, and eventually be able to churn out reports that we shall be able to use for decision making in an easy way. So that's the desire of everybody. And so as we continue, we welcome feedback, especially from the non-HIV colleagues who are now interacting with this system so that we can be able to see which areas to improve. And we are happy for those who are also onboarding to use KenyaEMR as a facility-wide system. The team is here to support you. So feel comfortable to reach out at whatever time, and then we can be able to embrace this together. Otherwise, I really want to appreciate each and every one of you, and I really want to wish you all a fruitful day, remaining part of the day, and a very restful weekend. And hopefully we shall interact in the coming week for the next sessions. So I have been told to say a prayer, so I want us all to believe as we pray. Our dear Heavenly Father, we are humbled before thy presence this afternoon. We want to thank you. We want to praise you because you have enabled us to be here. We do not take it for granted. Father, we have deliberated on certain issues in regards to patient management through the use of digitization. We want to commit them unto thy able hands, that even as we continue to think about how to make it best, Father, you're going to be with us, and your wisdom is going to guide us so that we may be able to offer the best. We want to thank you for this team that has been able to join, and even colleagues that are not able to join due to specific reasons. Father, may you give us the strength and the ability to continue working together as a team, all for the purpose of making sure that health service delivery is well offered at our health facilities. We thank you for the day that has remained, and even as we look into the weekend, we call upon you to take care of each one of us. Anyone traveling, Father, we pray for journey mercies, and even as we rejoin with our families, we pray that your peace, joy, and love is going to prevail. And this is our humble prayer of faith in Jesus' name. Amen.
Amen.
Bye-bye, and thank you.
Amen.
Thank you, everyone. Bye.